Good morning to you all, and welcome to today's webinar for the Ohio Opioid Technology Challenge, Topic 1, Diagnose, brought to you by 9 Sigma. My name is Jonathan Yakasha from 9 Sigma, and I will be your host and moderator today. Please note that this webinar is being recorded. The recording and transcription will be made available on the Opioid Technology Challenge page. Let's review our agenda for today. After I introduce our speakers, they will discuss the project in greater depth. We'll conclude by addressing your questions during a live Q&A session, followed by a brief summary of project information, including how to request additional information or assistance. As we proceed through today's presentation, please feel free to ask questions at any time. We'll keep track of your questions and respond to them during the Q&A portion of the webinar. Should you need any information or assistance outside of today's webinar, please feel free to contact the 9 Sigma Provider Help Desk at phd@9sigma.com. At this time, I'd like to introduce our panelists for today's webinar. First, we're joined by Sean Ryan, MD and MBA. He's the President and Chief Medical Officer of Brightview and President of the Ohio Society for Addiction Medicine. And from 9 Sigma, we're joined by Kevin Andrews, PhD, Senior Program Manager. Gentlemen, thank you both for joining us this morning. We'll begin with Kevin Andrews from 9 Sigma. Kevin, could you please give our attendees an overview of this challenge topic?
Thank you, Jonathan. So the challenge is a 3-phase prize-based competition to find technology-based solutions that address the opioid crisis through addiction prevention and treatment or overdose avoidance or response. We have, at this time, completed phase 1, the idea phase. We are now in phase 2, the challenge phase, which has up to 12 $200,000 prizes. The challenge phase winners can then compete in phase 3, the product phase, with submissions due in July 2019, with an opportunity to compete for up to 4 $1 million prizes. The Opioid Technology Challenge consists of 4 topics, broadly related to the theme words Diagnose, Prevent, Connect, and Protect. The focus of today's webinar is Topic 1, Diagnose, rapidly identify individuals at high risk of addiction.
Thank you for that, Kevin. We'll turn now to Sean Ryan from Brightview. Sean, could you please share with our attendees some additional information about this particular topic within the overall Ohio Opioid Challenge?
Absolutely. Thank you for having me. So you'll see on the slide here the kind of complex multifactorial issues leading to addiction in patients. And particularly today we're going to talk about opioid use disorder, of course. It's important to understand how complex this development is in order to develop tools to identify it, and we're going to talk about what buckets of patients I feel like this project in particular can be applicable to. So as you can see here, the 3 main factors that we know to be the case are biology or genetics, and now we have much better handle on that issue than we did even 10 years ago. Environment, and environment means how you grew up, which many people don't have any kind of choice in, but can be ascertained by survey, questionnaire, interview, etc. And that's a very important factor, as you can see here, again, including chaotic home and abuse, adverse childhood events, etc. And then exposure is a key factor as well, leading to opioid addiction, and that's the topic we'll talk a little bit more about in a second, because the buckets of patients we're dealing with, and I'm going to be somewhat simplistic in identifying them, need to be addressed in ways that exposure is limited to any of those kind of categories of patients. Next slide, please. I think that the goal of this challenge, Diagnose, to identify the risk of addiction, should absolutely take into consideration those 3 basic drivers, but understand that it is more complicated than just those 3 things. And in the previous slide, you could see the other factors. There's also many other studies that I would encourage any participants to evaluate for what has previously been studied and validated that can be risk identification tools. So I will say that this is definitely not the first attempt to identify these risk factors, but applying that in a technological fashion as well as potentially moving it to more of a kind of a workflow appropriate prescriber applicable solution is something that's still I think new or in development. So I would say that it would behoove those folks who might participate in this challenge to look at things like Preventers personality testing programs, which focus on the 4 risky traits you can see here, and I left the reference here from the New York Times. It talks about that personality testing program that's really focused on kind of adolescent risk identification, but there are other tools like that can be used. And again, there's a very long list of these types of screening tools that are history-based. There's also, in a different bucket of patients, the NIDA quick screen, which is an identification of patients who may have substance use disorder, and those types of tools are fairly pervasive in their, let's say, in their development, but in the utilization, we don't actually currently, in many of the health systems I'm aware of, I don't believe that many providers are actively using things like the NIDA quick screen on a regular basis with ubiquitous screening. Next slide, please. In order for the tool or solution to be functional, you have to first identify, but then be able to act on the information. This is an extraordinarily important point because solutions have to be easy to use with a simple user interface. It can't require multiple logins to different databases and things that are outside of the workflow of the medical providers who are going to be identifying and then acting upon this information. It must fit into the workflow as stated. That's almost as an important point as the previous one. And for those folks who are not used to understanding the workflow of medical providers, I would venture to say it'd be key to any solution or participant to really get into the nitty-gritty of medical providers and how they prescribe opioids, why, when, to whom, in order to be able to intervene at the appropriate time. And it's key that information needs to be obtained and deciphered quickly. Let me give one example of a previous technology solution that took advantage of this. At this time, the Prescription Drug Monitoring Report in Ohio, ORS, is not fully integrated into every electronic medical record, but that solution is underway. There's lots of work being done on that. Back in 2011, 2012, I participated in a project with Mercy Health where we did fully integrate that PDMP tool, which has now been improved to more of a clinical decision tool, but where we did participate in integration of that tool into Epic at a hospital in Cincinnati. The full integration, meaning 2 clicks to the information for the provider to be able to make that decision, monumentally shifted the utilization of that screening tool and allowed providers to have that information at their fingertips very much in their workflow. It was an absolutely critical decision that we made on the front end of the project, and increased utilization of that technology by over 400% from baseline. It's also important to understand that this tool, our solutions need to be cost efficient. Coming up with things that cost thousands of dollars per patient is going to be a tough sell if we want to use broad scale identification for a lot of patients. And we know from several studies over the past 10 years that so many patients have been exposed or are at risk for opioid use disorder that this solution needs to be cost efficient. I think it also needs to accurately define the risk, meaning we don't, those familiar with the scientific testing methodology, it needs to be both sensitive and specific. You don't want it to miss many patients, but you also don't want it to overqualify patients and potentially cause issues with prescribing of opioids. Next slide, please.
Great, thank you for that, Sean. We'll turn back now to Kevin from 9 Sigma. Kevin, we've heard from you and Sean this morning. Could you tell our listeners a little bit more about information they should include with their proposal, how their proposals will be evaluated, that sort of information?
Sure, Jonathan. So your solution has to use technology as a component of your approach. That technology could include sensors, diagnostics, medical devices, pharmaceuticals, and/or health information technology. It can also include software, but that should be in conjunction with one of those technologies above. You must already be working on your approach. You should have proof of concept data that's compelling, that will support the effectiveness of your approach. You need to have a clear plan and path forward to get your technology ready for broad deployment or implementation. And your approach must be able to be implemented in the United States. It should be likely to receive regulatory approval, and you'll need to be able to demonstrate that approach in conjunction with an Ohio-based entity if you're going to move forward past the challenge phase. So there are some approaches that do not qualify. Those that are strictly at an early stage of development are not eligible. Solutions that require a change in current law, policy, or regulation are also not eligible. Clinical treatment protocols that are not associated with a new technology development are not of interest. Alternative pain management therapies, predictive analytics to inform public policy, and programs for direct delivery of social or clinical point-of-care services that don't have a significant technology component, those are all not qualified approaches. Strictly education and public awareness programs or professional training programs are not qualified. You can have elements of professional training in order to teach people how to use a tool or the technology that you're developing, but it's not, strictly speaking, we're not talking about just professional training. Okay, so the general evaluation criteria that we will apply in evaluating your submission is to consider how your approach aligns with the key attributes for the topic. And I'm going to talk about those key attributes momentarily. The technology maturity and time to market of your proposed approach. So for similar approaches, preference will be given to the one that is more mature and/or that has a shorter time to market. The potential for broad deployment or implementation, the size or scope of the audience impacted, the so-called market size, the robustness of your approach, and the effectiveness of your approach. Those are all general evaluation criteria. So for topic one, the key attributes, your approach needs to enable identification of a person's risk of addiction. It should offer clear interpretation or signaling. It should offer concrete evidence that demonstrates efficacy. It should be effective in as short a time as possible. It should be robust, having a low occurrence of false events. It needs to be easy to implement and use, both from the patient and/or clinician perspective. So what possible approaches might exist? It may be that one of these is a possible approach. Certainly, this is not a limiting list. So physiological or genetic diagnostic technologies, diagnostic questionnaires, and/or analysis algorithms could all be part of your approach. So what do you need to submit your technology for consideration in the challenge? This table is all of the elements of the proposal response. And I'm not going to read these here. This content is available on the website. It's available in all of the challenge need descriptions. You can prepare your document to reflect these elements. In terms of the timeline, today we are conducting the webinar for topic one. The challenge was launched back in February. The deadline for submission is July 11th at 5 p.m. Eastern. The challenge phase recipients will be announced on September 18th. The product phase will begin after that announcement and continue through July 2019. And the post-challenge phase will occur in the years 2019 to 2021.
Great, thank you for that, Kevin. It's now time for the frequently asked questions. Now, these are questions that have either A, already been submitted to the 9 Sigma Provider Help Desk, or B, are questions that are very common with 9 Sigma projects, and we'll address them here. So, our first question, can you please explain what you mean when you say that you have to be an entrant, registered to do business, and in good standing with the state of Ohio?
Yes, so regarding that registration, you can go to this website from the state of Ohio that contains the filing forms and the fee schedule. A non-Ohio entity would choose Form 530A if they're a for-profit organization, and Form 530B for nonprofit. The registration fee is US $99.
Question 2, when do I need to register to do business in Ohio? Before submitting a response or before accepting an award if I was chosen to receive an award?
Good question. So you do not need to register to do business in Ohio in order to submit a challenge response. If your submission is selected as a winner, you would then need to register to do business in Ohio before accepting the award. Keep in mind that your registration with Ohio will require a certificate of good standing from the state in which your organization is incorporated. And that statement must not be older than 90 days prior to the date in which you submit your registration to Ohio.
Question 3, who is eligible to compete for the product phase?
Only winners of the challenge phase are eligible to compete in the product phase.
Question 4, do I have to fill in each section of the online response form, or can I prepare my submission as an attached document?
You can do either. Please pay attention to those elements that we listed on the how to submit elements of your response slide previously. Please adhere to the page limits, and remember that you can also upload supporting documents and provide a video link if you wish.
Question 5, what will be required of challenge phase winners to be able to compete for product phase awards?
Challenge phase winners will be required to execute a non-disclosure agreement with 9 Sigma and submit a more detailed plan that explains tasks, timeline, and deliverables that you plan to follow to continue the development of your technology for deployment or commercialization. You also need to explain how you're going to involve an Ohio in-state entity in your effort. Then, during the period from approximately October 2018 July 2019, you work against your plan.
Okay. And our final FAQ, what will be required of product phase winners after they accept their award?
Winners of the product phase award will be obligated to deliver periodic reports to 9 Sigma from Q4 2019 through Q4 2021. 9 Sigma will ask you to provide some information that would be disclosed to the state of Ohio. Other information will remain confidential, and we will provide further details about this process before the product phase starts.
Thank you, Kevin. So it is now time for the Q&A portion of today's presentation. Please submit your questions via the question box. We'll go through those questions as we receive them today. If you think of a question outside of today's webinar, don't worry. We'll have some additional information in just a moment as far as getting those questions answered. But during today's webinar, this is an excellent opportunity to pose your questions directly to our panelists for their feedback. At this time, we'll begin with our question. So our very first question, any idea when you will be hosting the webinars for the other challenges? Kevin?
So this is the final webinar. We have done the webinars for the other 3 topics. However, if you missed those, we are posting the video recording and the transcripts for all of the webinars on the respective project pages on the website. 2 of them have been posted. The remaining 2, obviously this one today and the one we did last week, will get posted as soon as they become available.
Great, thank you, Kevin. We're getting a number of questions along this line. I'll just go with this one. If my solution goes across various challenge topics, do I submit for each individual challenge, or do I submit one application?
I think it would be best if you submitted separate applications. You'll notice that the response form, the elements of your submission are similar for all of the topics. The big difference from topic to topic is that they have different key attributes. The reason I would submit them separately is that if one approach was deemed less interesting by the evaluation panel, the other one could still be considered.
Okay, great. Our next question. Is the challenge topic focused exclusively on the identification of opioid addiction risk, or can it include other risk factors such as the risk of opioid overdose?
Sean, would you like to provide some insight to that question?
Sure, it is an interesting. Sorry about that.
Sean?
I was making sure my connection was good. Yeah, I'm here. I was making sure my connection was good. It is an interesting question. In reality, if you're identifying somebody at risk for addiction in the way that I've been thinking about this topic, more in an early phase, so as previously spoken to, kind of more pre-exposure to opioids in general, or after initial exposure but not yet quite identifying opioid use disorder, you're going to be far ahead of the risk of opioid overdose. So opioid overdose risk is really assessed kind of more in late phase addiction, where the patient has defined opioid use disorder, moderate or severe. So it's a little bit of a tough question, because I would say where the goal of this project is to identify those that are kind of earlier in their phases of addiction, to really prevent further stage risk of opioid overdose.
Okay, great.
Thank you, Sean.
Kevin, you touched a little bit on this previously. Can you confirm the dates for when the awards will be announced and allocated?
Yes, so the awards are going to be announced on September 18th. We'll contact the awardees prior to that. The date is a little bit fuzzy at the moment, but we essentially need to go through a process of approval prior to that disclosure on the 18th, so roughly the beginning of September. And awards will be made available approximately within that time frame, the specific date yet to be determined.
Okay. Our next few questions actually kind of build off of that general topic. First, can you use funds out of state, or do all prize funds need to be used in state?
So that's an interesting question. Ultimately, for you to continue in the competition, you will have to involve someone who is considered an in-state entity, or you will have to become registered to essentially have a significant in-state presence. You'll have to create an in-state presence in order to continue to compete. Realistically, because you're going to partner with an in-state entity, you would likely have to share resources in some form or fashion. The objective, really, with the state of Ohio is in part to foster economic development within the state, as we're also trying to solve this problem.
Okay. Again, staying with the topic of funds, can you use the funds to help deploy your product to market across Ohio?
Strictly speaking, you can use the funds as you see fit, subject to essentially convincing the judges that your proposed approach is worthwhile. If you're at a state in development where you're ready to deploy, that's certainly a possibility.
Okay. And staying with funding, are there any other restrictions on the use of funds that our attendees need to be aware of?
None that I can think of at the moment. Please consult the challenge phase rules, and keep in mind that we will be posting some additional content that defines the requirements for the next phase.
Okay. Is there any requirement to obtain matching funds? Also, would having matching funds help with their application, with the overall score of their application?
Okay. So in the strictest sense, there is no requirement to have matching funds, and in the sense that there's a specific score for having those funds, there isn't. However, having matching funds and a path that describes how you're going to deploy your solution, that may impact how quickly you get your solution to market. So indirectly, it sort of matters.
Shifting gears a little bit, this next question, if my solution is already on the market but with low penetration, approximately 1,000 prescribers using it, primarily in one state, would I be eligible to apply for the challenge, or are currently on-market solutions excluded from applying?
This one's a little tricky. I guess that, strictly speaking, there's nothing that says an on-market solution is ineligible. In some sense, you have an advantage because your time to market is potentially shorter than someone else's approach. And you've certainly met the requirements related to being already working on the approach and having some efficacy data to support the approach. So it's certainly plausible that your approach would be eligible for consideration, and it'll be up to judges to decide whether your approach is stronger than another.
Okay. Kind of keeping in that theme, if my solution already exists and is used for clinical decision support of opioid prescribing, and we'd like to add some additional component functionality to enhance it, to give it the ability to perform early detection of OUD, would this be an eligible solution?
So focusing on the enhancement, yeah, I would say it's eligible. It certainly, there could be elements of your existing solution that provide context and support for your approach, but it's that enhanced functionality that you're potentially competing with. It's important that you are at a stage beyond just a concept, however. So you'll need to have some data in hand to support the idea that your approach has validity.
Okay. Our next question, should the technology focus on a person's risk of addiction broadly, or should it focus on the risk of addiction to opioids in particular?
I think this question was similar to the early question that Sean answered. Strictly speaking, this program is about opioid addiction, but in the context of understanding how one's environment influences the prospect of someone being an addict, that the broader point of view is certainly part of the picture.
Okay. We've gotten a couple of questions kind of along these lines. The question is the technology to be used by a medical professional or by a lay person, by a patient, I guess?
Yeah, the answer is this is intended for medical professionals.
Okay. If my technology focuses on the risk of addiction to a single chemical, is that still of interest?
It could be. I'm not certain whether that. Let's say, for example, you have a technology to detect addiction to an illicit opioid versus a prescription opioid. Correct me if I'm wrong, Sean, but probably the approach for the illicit also has some impact on the prescription, because it's really about how opioids are handled by a particular person.
Yeah, I was just going to say, I mean, that the past two questions actually have a little bit of overlap. I'm not really sure how a technology could specifically identify risk for addiction to a singular chemical. That is not really how I understand it at all. And I would, I'd be interested to know more about that particular issue, but I'm not really sure how that's applicable. And I would also say it's important. There are many patients who have, or people who have general risk factors for addiction that would need to go into any sort of identification tool, and that could later be utilized in ways to deal with broader substance use disorder. But in this particular environment, in this particular challenge, it's really about opioid use disorder, opioid risk of addiction, and opioid prescribers. And so, although there will be factors that could feed into a risk assessment identification tool or solution of any sort, this one is keenly focused on opioids, in my understanding.
Yeah, thank you. Thank you for that.
Okay, our next question kind of builds a bit on the previous question about who the user of the technology would be. Can the diagnostic technology solution be targeted to social workers who are non-medical professionals? So in essence, not the patient themselves, but a professional nonetheless.
Sean, do you have a point of view on that?
Sure. So it really comes down to, in my mind, workflow. And in my reading of the challenge document, it really spoke to providers' identification in order to take action upon risk of addiction in prescribing of opioids. I think that in a multidisciplinary team, you might see a case in which the social worker or other team member performs or facilitates the risk assessment, but that information needs to flow through the medical provider to take action on it in the way that the challenge is written. This is not necessarily about identifying folks and then referring them to others for assessment or whatnot, again, in my understanding.
Yeah, thank you for that.
Okay. We're experiencing a little bit of a slowdown in some of the questions. We've had a number of great questions coming in from our attendees, so thank you for that. I'll pause for just a moment here to say that if you've got questions, this is a great opportunity for you to pose them to our panelists for their feedback today during today's webinar. If you think of something outside of today's webinar, don't worry, we'll have some information on an upcoming slide about how you can get some assistance for you. With that in mind, I'll go ahead and proceed to our next question. The next question being, and I think this one is, Sean, perhaps best addressed by you, and I think you touched on it a little bit earlier during your slides. Can you identify screening measures that can be administered online or in person to reliably identify addiction potential?
The first place I would start, if I were to refer someone, would be to the NIDA website for screening tools, NIDA. They probably have the broadest compilation of validated screening tools that I know of. There are others, of course, but I think that answers the question where people should really look to understand where such tools exist. And yes, folks have put those in kind of technological solutions where it can be administered easily through web format, and some of which, again, to be clear, those are both administered by professionals to a patient as well as can be taken by oneself for appropriate evaluation. And so it's a pretty complex issue, but I think that's where I would refer people to, and yes, they do exist.
Okay, great. Thank you, Sean. We will turn back to Kevin from 9 Sigma. Kevin, what are the policies for out-of-state participants?
Good question. So out-of-state entities may submit to the challenge phase. You're going to need to be thinking about and planning for the next phase, in which, in order to compete beyond the challenge phase, you will have to get involved with someone from within the state, or you will have to establish a significant presence here in the state of Ohio in order to be considered for the follow-on competition. You have time. You can certainly submit a challenge phase response without having that in-state component totally figured out. The expectation is that If you're awarded a challenge phase award, you can use the time between now and that award and shortly thereafter to find a suitable partner organization to work with within the state. And you'll be allowed to essentially adjust your team accordingly for efforts going forward. But if you get to the point where you're competing for the product phase award, the $1 million prize, and you don't have a way to involve someone in the state of Ohio, you're going to have a problem being eligible for that award.
Okay. Thank you, Kevin. It looks like we have exhausted all of the questions that are coming in from our attendees. Oh, excuse me, I stand corrected. We have our next question coming in just right now. The question is, can the target user be a medical professional working for health plans providing quality oversight for patients who can communicate any addiction risk to the patient and or prescribing physician?
This is Sean. I actually think that's an interesting perspective to come from, and as plans get more involved in kind of management of patients' health status overall, I would think that solution might be applicable. It would have interesting limitations in that it would be kind of information review only. It would seem to me if it was being utilized by a health plan, but I would advocate for, at least evaluating that opportunity.
Thank you, Sean.
Again, we have another question coming in just right now. Right, the question is, we have in-state partners already. Is there any requirement or policy regarding funds distribution? I'm guessing they're trying to get at the splitting of funds between the in-state partner and the out-of-state entity.
So this is Kevin from 9 Sigma. There are no strict requirements for how that money is divided. You would have to negotiate with your partner entity how you would expect to share resources, and resources meaning the award and your own time and materials and their time and materials, or service hours. So no, it's negotiable. The idea is that some of the money is going to get channeled towards someone from that's in the state of Ohio, but the specifics will depend upon your own arrangements with that partner.
Okay. If one wins the phase 2, does 9 Sigma provide matching funds with the Ohio-based entity? Oh, excuse me, not matchmaking, not matching funds, but provide matchmaking with the Ohio-based entity.
No, strictly speaking, we're not. That's not part of the program. It will be up to you to identify partners on your own. That said, yeah, we don't really have the means to do that. It's up to you.
Okay. This next question goes to eligibility. We're working under a grant through the Ohio Third Frontier to develop technology to predict opioid addiction. Does that grant prevent us from applying to this challenge?
So this is Kevin. I'm going to have to defer that question. We'll get back to you.
Okay. Our next question. How important is it to distinguish between A, screening to identify risk, and B, diagnosis to establish the presence of a disorder?
Sean, would you like to weigh in on that question?
Sure. Again, from my reading of the challenge documents and the intent, This is not a solution intended to diagnose opioid use disorder, but to identify the risk of addiction and potentially prevent progression. And that, again, in my mind, generally patients fall into three groups, which are never exposed but with risk of addiction, therefore needing to be carefully managed if ever exposed to opioids. The second group is exposed to opioids, minimal dependence to dependence, but no diagnosable opioid use disorder. And then last, of course, is opioid use disorder. And again, I wasn't the primary author of the challenge documents, but my understanding of the intent is that this is not a quest to a solution for diagnosing opioid use disorder.
Thank you, Sean.
Okay.
Sure.
Thank you to all of our attendees for that great flurry of questions that just came in. It looks like, once again, we may have reached a little bit of a lull. If there aren't any further questions at this time, I will go ahead and proceed to close out the Q&A portion of today's webinar. Again, if you think of a question, please don't worry. We'll have some information for you on the next slide about how you can get assistance. So, for our attendees, what can you do today? First and foremost, you can obviously visit the challenge page. The URL is up on the screen there for you. While you're there, you can register to receive updates to the project. Now, should you need assistance, whether it's a question about the scope of the project, your eligibility, what have you, you can reach out to the 9 Sigma Solution Provider Help Desk. There's 2 ways to go about doing that. You can either A, send us an email. The email address is phd@9sigma.com, or you can give us a call at 216-283-3901. Once again, that phone number is 216-283-3901. Either way, we'd be happy to take your call or your email and get you the information that you're looking for. Lastly, and very importantly, the submission deadline, July 11th, 2018 at 5 p.m. Eastern Time. That's a hard deadline. We won't be able to accept any proposals after that 5 p.m. deadline. So we strongly encourage you to begin working on your proposal well in advance of that deadline time. We'd hate to miss out on your submission because of a computer glitch or problem of that sort. So with that in mind, I would like to conclude today's webinar by thanking our panelists, Sean and Kevin. Thank you for your time and for your insight today. To our attendees, thank you for listening. Thank you again for your great questions. We definitely appreciate your involvement in this project. And thank you, all of you, for being here today, and we look forward to seeing your submissions. Thanks, and have a great day.